Histology of Urinary System, Part 22 by Dr. Muhammad Al-Rayah. We will talk about this lesson by using the mind map. So let's go. The urinary system. Before we talk about histology, we must know urinary system consists of about 2 kidney and 2 ureters, besides a urinary bladder and urethra. This system contributes to maintenance of homeostasis by a complex of process. The result is the production of urine, in which various metabolic waste products are eliminated. Urine produced in kidneys passes through the ureter to the bladder, where it is temporarily stored and then released to the exterior through the urethra. The four processes is filtration, secretion, beside absorption. Absorption, there is 2 types of absorption: active and passive absorption. The 2 kidneys produce about 125 ml of filtrate per minute. Of this amount, 124 ml is absorbed, and only 1 ml is released into the ureter as a urine. About 1,500 ml of urine is formed every 24 hours. When we talk about blood flow in the 2 kidneys of an adult, amounts is 1.2 to 1.3 liter of blood per minute. This means that all the circulating blood in the body passes through the kidneys every 4 to 5 minutes. When we talk about kidney or some kidney function, there are regulate the fluid and electrolyte balance, regulate to electrolyte balance and the fluid. And if we would talk about production function, it is a product to renin, which regulate blood pressure, and production or produced to erythropoietin, which growth factor glycoprotein to 30 kDa, which produce erythrocyte. Erythropoietin hydroxylate vitamin D3 to active form. We must know that vitamin D3 is a steroid pro-hormone. We talk now about renal corpuscles. Renal corpuscle is about 200 micrometer in diameter and consists of a tough capillaries. It's called glomerulus, surrounded by a double wall epithelial capsule called glomerular capsule or Bowman's capsule. There is internal layer or visual layer of capsule involve the capillary of the glomerulus, and outer layer called parietal layer of Bowman capsule. Between the 2 layers of Bowman capsule is the urinary space. Urinary space which receive the fluid filtered through the capillary wall and the visceral layer. As renal corpuscle has a vascular pool, a urinary pool. Vascular pool where afferent arteriole enter and efferent arteriole leaves, and urinary pool where the proximal convoluted tubule begins. After entering the renal corpuscle, the afferent arteriole usually divide into 2 to 5 primary branches as they subdivide into capillaries and forming the renal corpuscles. Then we talk about parietal layer of Bowman's capsule. consists of simple squamous epithelium supported basal lamina and the thin reticular fibrous. When we talk about parietal layer, during embryonic development, the epithelium of the parietal layer remain relatively unchanged. Then we talk about the proximal convoluted tubule have simple cuboidal epithelium or a low columnar. Then we talk about the podocyte. Podocyte have a cell body from which arise several primary processes. Podocyte and the primary process don't touch the basal lamina. Primary process give a numerous secondary process called pedicles or secondary process. Secondary process impress the capillary of the glomerulus at periodic distance of 25 nanometer. The secondary process are in direct contact with the basal or the basal lamina. Then the secondary process of podocyte interdigating, defining elongated space about 25 nanometer. We call them filtrated slide or filtration slide. Then podocyte have a bundle actin filament give the podocyte capacity to contraction. When we talk about visceral layer from Bowman capsule, the cell of this layer called podocyte, and during embryonic development have a great modification in their epithelium. The basement membrane. When we talk about basement membrane, is derived from fusion the capillary between capillary and podocyte to produce basal lamina. Basement membrane is a filtration barrier, where like filtration barrier between urinary space and the blood in capillary. The glomerular basement membrane is a selective macromolecular filter. So then we talk about electron microscope, basement membrane and electron microscope. Center electron densa lamina or lamina densa. Lamina densa have a meshwork from collagen type 4 and a laminin in the matrix containing the negative charge. We cause a protoglycan heparin sulfate that restrict the passage of cationic molecules. Lamina densa act as a physical filter. Then we talk about electron about lamina rara or electron luxant layer on its side. Lamina rara contain fibronectin, which may serve to bend them to the cell, and where the anionic site in the lamina rara act at charge barrier. The glomerular filter is formed in response to hydrostatic pressure. It's obeyed by two things: plasma colloid osmotic or oncotic pressure and hydrostatic pressure of fluid in Bowman's capsule. Is the net filtration pressure at the afferent end of glomerular capillaries then we must know that the glomerular filter has a chemical composition similar to that of a blood plasma but contains almost no protein. Then we talk about mesenteric cell. Mesenteric cell or middle vessels. Firstly, mesenteric cell synthese endocytosis and dispose of normal and pathologic molecule trapped by the glomerular basement membrane. The second thing which is synthesized extracellular is the extracellular matrix. There are extraglomerular mesenteric cell. We found them out glomerular vesicular pool, which is part from juxtaglomerular apparatus. Then we talk about that mesenteric cell produce chemical mediators like cytokinase and the prostaglandin. Mesenteric cell give structural support to the glomerulus, and mesenteric cell as a receptor have a two receptor. Angiotensin 2, when activated, the glomerular fellow is reduced, and the second receptor is natriuretic factor produced by cardiac atria cell. This factor is relax and vasodilation. These two things increase to a blood flow and effective surface area. And finally, we found mesenteric cell adherent to the wall.